Okay. Hello, everyone. Today we are going to be talking about lip range of motion and lip strength. This treatment targets the oral phase of swallowing by increasing the strength and mobility of your lips in order to ensure lip closure. This is important to prevent bolus escape from the anterior oral cavity, and it's also important to have lip closure to ensure that the oral cavity is closed so that intraoral pressure can build up and lead to efficient bolus transport. This is related to component 1 of the MBSIMP, which is lip closure. And the main muscle involved in this exercise is the orbicularis oris, which is innervated by cranial nerve 7. And there's a variety of exercises that can be used, and they involve stretching and puckering the lips in order to increase their range of motion and their strength.
So to do these exercises, the patient should be sitting upright and have a clear view of you so that they can see you demonstrate the exercise, and then also so that you can see them doing the exercise and give them feedback. So you want to make sure that the patient is not demonstrating poor form. Like if they're getting tired, but you also want to make sure that they're not, and you also want to make sure that they're not feeling pain. So if the patient begins to feel pain or discomfort, instead of just stretching while doing these exercises, you should instruct them to stop. And then for the materials, all that you need is a tongue depressor, or I don't have a tongue depressor, so we're going to use a plastic fork at the end of it.
Yeah, I have a pair of chopsticks that I'm using. I'm just using the end, so it's kind of like a tongue depressor. So just basically anything that resembles the shape of a tongue depressor can work if you're not doing this like at a clinic or hospital or something. Okay, so I am going to be the clinician and Shelby is going to be the patient. Okay, hello Shelby, how are you doing?
Good, how are you?
I am good. So today I'm going to be teaching you exercises that are meant to increase your lip range of motion and lip strength. Strengthening these muscles will help your swallowing by ensuring lip closure, which prevents food or liquid from escaping your mouth. The first two exercises I'm going to teach you are going to focus on range of motion, and then the last two exercises I teach are going to be targeting lip closure. So when you are doing these exercises, you want to be sitting upright, and the materials you need are a tongue depressor, but if you don't have a tongue depressor, then you can use something that kind of resembles the shape of a tongue depressor. I have a pair of chopsticks, just I'm going to be using the end, but yes. And then whenever you're doing these exercises, I don't want you to be doing this to the point where it's painful or like you feel discomfort. So if you start to feel pain, stop and rest, and like we can come back to it and address it a little later. But we don't want you to experience any pain while you're doing this. Okay? Okay. So our first exercise is lip protrusion. So for this exercise, you're going to pucker your lips as if you were going to give someone a kiss. And while doing this, you need to keep your jaw closed. And this is important because you don't want to use your jaw as like a way to give your lips assistance or support. We kind of want to isolate your jaw so that you're just focusing on strengthening your lips. So you're going to keep your jaw closed, pucker your lips, hold it for 5 seconds, and then you're going to relax and repeat it 5 times. I'm going to show you how to do that. So that's the first one.
So if you keep your jaw closed, does that mean like this?
Yes. So you want your teeth to be kind of like touching. Good. Thank you for that question. So our second exercise is lip retraction and protrusion. So this one we're going to kind of alternate between smiling and puckering your lips. And same thing with this exercise, you want to make sure your jaw is closed. And whenever you're smiling, you want to kind of do it to where you feel a little bit of stretch. But again, we don't want you to feel any pain. And you're going to go from smiling to puckering your lips. And you are going to do that 5 times. When you're doing this, you want to kind of use exaggerated movement. So we're making sure that we're really stretching and strengthening your lips. So it's going to look like this. Any questions for that one? Okay. Next, we are going to do a lip press on a tongue depressor. So what you're going to do is you're going to have a tongue depressor or something similar, and you are going to tightly press your lips around the tongue depressor. And whenever you're putting this in your mouth, you want to make sure it's just past your teeth and sitting on the tongue. And while we're doing this, you just need to gently pull against the object so that it provides some resistance, because we need some resistance in order to really strengthen the muscles. So it's going to look like this. And you're going to do that for 3 to 5 seconds and then relax and repeat it 5 times. Any questions for that one? Okay. And then our last exercise, we're going to be doing, you're going to puff your cheeks. So you're going to fill your cheeks with air and then move the air from one cheek to the other cheek 5 to 10 times. And while you're doing this, no air should escape from around your lips or your nose. And so each rep is 5 to 10 times, and you're going to relax and repeat that 5 times. So it's going to look like this. And then relax and redo that 4 more times. Okay, any questions with that one? Okay, so now let's see you do it, and I can provide you with any feedback. Okay, so first let's do the lip protrusion, where you're gonna pucker your lips while keeping your jaw closed, hold it for 5 seconds, and I'm gonna count for you. And then we're gonna do that 5 times, okay? Okay, so just start whenever you're ready. Okay. Good. Okay, one more. Okay, good job. Did you feel any pain whenever you were doing that? Okay, perfect. Okay, so next we are going to do the lip retraction and lip protrusion, and this is where we're switching between exaggerated smiling and doing the lip puckering. And remember to keep your jaw closed, and we are going to do this 5 times. Okay, that's 1, 2, 3, 4, 5. Good job. And any pain doing that? Okay. So next we are going to do the lip press on the tongue depressor. What are you going to be using to do this? Okay, the end of a fork. That sounds good. Okay, so just press your lips tightly around it and provide a little bit of resistance and I'll count for you. Very good. And then 4 more. Good. Good job.
You say using a plastic fork is not the best thing because I could kind of feel it sliding, like not because of my lips, but because there's not the texture that a tongue depressor has. But obviously, just for the purposes of this treatment demo, it works.
Okay, so our last exercise, we're gonna puff our cheeks and move it from one side to the other 5 to 10 times. Make sure that no air is escaping from your lips or your nose. Okay, let's see it. Done. Those 3, 4, 5. Good job. And did you feel any pain while doing that? Okay, perfect. So these exercises you can do at home, and I'm going to provide you with a data sheet that you can kind of report the times that you do them. And if you have any questions, do not hesitate to ask me, reach out.
Thank you.
Of course.